Greetings and welcome everybody. I'm Dr. Malvika Kamat and this is Dr. K. Mukund, the Director of Bangalore Heart Scan Foundation. Welcome, Doctor.
Thank you.
We've heard a lot about the Bangalore Heart Scan Foundation. Could you please elaborate on when this was established?
This is a standalone center which provides for imaging of the heart and the rest of the body. Established in 2006, it concentrated mainly on the preventive aspect of cardiac care. And to start with, we were particularly focusing on angiography, non-invasive angiography, as an alternative to conventional angiography. And now currently we are focusing on calcium score, which is an evidence of deposits on the coronary artery which causes block, which we call it atherosclerosis. And currently we are mainly focusing on preventive cardiology with this modality as an early detection test.
Okay, so this is called the calcium coronary scan, if I'm not wrong.
Right.
Yes, so what does the calcium coronary scan involve, Doctor?
This is the test which currently is done to detect the heart disease which causes heart attacks early. And it is now very intensely promoted by insurance companies to prevent their clients from getting heart attacks. Thereby they gain in terms of avoiding claims, huge claims by angioplasties. And by early detection, it is now known that you can prevent heart attacks for many years to come by simply using preventive methods like lifestyle changes as well as medications.
So Dr. Mukund, it's very impressive that you are one of probably the first interventional cardiologists in Bangalore. What seemed to make you shift or emphasize more towards preventive cardiologists instead of going to the glamorous surgical side of cardiology, what most people do?
Well, I've seen the patients getting heart attacks as early as 20 years. My, the youngest patient was 19 who had a heart attack. But that's an exception. But otherwise, heart attack visits people, men above 35 and women after the menopausal age. That's beyond 45. And if you have to treat patient with angioplasty, first of all, you are providing an expensive treatment,
yes,
which doesn't guarantee you the results. On the other hand, the preventive steps give you much better results with much lesser cost.
Mm-hmm.
And for a population like ours, which is huge, as well as being less affordable, angioplasty is a painful procedure in terms of cost.
Yes.
So the choice is not difficult to make,
mm-hmm,
and nothing like prevention, and preventing heart attacks. Today we have a program when you start early as 35 in men, 45 among women. We can prevent heart attacks for many years to come,
mm-hmm,
provided you start early,
okay,
as I said,
yeah,
and start with preventive strategies.
mm-hmm,
Reduce the chances of heart attacks substantially, and by any chance the heart attack still occurs, you can take up the interventions which would be much later,
yes,
much beyond your productive years.
yeah.
So in short, I can say that we can prevent heart attacks
More effective.
Among those who are working during their service years and many years later, many years later. So now we are saying that we can prevent heart attacks till the age of 70 and more. And I am setting the age 70 because our average lifespan in India is 68 years now. So you have two more years of heart attack free
Yes.
years, and after 70 it can be left to the patients to decide how he wants to go about this problem.
So Dr. Mukund, I've heard about calcium in bone, teeth, etc. But honestly, I haven't heard about calcium in the heart. So could you please let us know what does that imply and how does that affect the heart, please?
The heart is supplied through the what's called as narrow arteries, which are about 2 to 3 millimeters in width. We call coronary arteries. Atherosclerosis is a process where cholesterol gets deposited, and in all these areas calcium falls. Blocks in the coronary artery is due to deposit of this fat material, cholesterol, and the calcium, when it follows, it gets deposited on the wall, and it grows into the tube and causes the block. This is the material, this is the deposit that this machine picks up.
Which is a calcium coronary scan machine.
Yeah, that's it. And it gives also the quantum of this kind of deposits in the coronary arteries. Not every scan machine can have it. These are specialized systems where it is able to disable the movement of the heart and image it accurately. And the process involves a sophisticated system which we have in the form of a Siemens system, which 64 slice multi-detector CT.
So Dr. Mukund, it's quite common knowledge for any common man to come in to do a treadmill test to detect the incidences of the heart or diseases, and sometimes even go to the echogram and ECGs. Where does calcium coronary scan fit in the process of doing things? Is that the first thing you'd want to do?
Yeah. Now, it has not displaced these tests. They are still valid. But the limitations have been now overcome by the calcium score. So much so, calcium scan or calcium score test for the heart is the screening test to detect these deposits, which cannot be picked up by ECG early. It cannot be picked up by treadmill, which miss half even if the block is more than 50%, until then it is, you have no symptoms. And the treadmill will not pick up. Even if the block is above 50%, when a treadmill is supposed to pick up, there are problems with the treadmill because it's an indirect test. So much so, you have what's called the false positive and false negative. Net result is that half the time you either miss it or you overdiagnose, or you diagnose where it is not there. So it is not accurate. Now, echocardiography picks up once there is a damage to the heart. Otherwise, it doesn't pick up the coronaries. It doesn't pick up the blocks, but it picks up only the damage that is caused by the block in the form of heart attacks. So, we have here a wonderful test which takes seconds only to go through and involves no injections. It's simply a scan with the least X-ray dose, 4 times to 6 times the chest X-ray. And that's where this comes in as a strong test which can be applied to all without fear of any side effects. And that's why, and it's most accurate. If it is there, it is there. If it is not there, it's not there. You can almost say that with an accuracy, 99% accuracy. So much so, early detection helps in preventing further progress of the disease with various methods that we know helps.
So Dr. Mukund, who should be undergoing this calcium coronary test?
There is no doubt that everybody, if he is 35, with even a single risk factor, and women above 45 with a single risk factor would mean family history, diabetes, hypertension, high stress, smoker, and high lipid levels. one thing I want to stress here is that it doesn't mean that if your cholesterol level is so-called normal, you are free from heart attacks. No, it's not true. The general impression is that you should have a high cholesterol. If your cholesterol level is normal, you are safe. That's not true. Cholesterol also level is one of the risk factors. Higher the level, greater the chances. But nobody is immune from developing heart attack, even if his cholesterol level is low.
So minimum age would be then?
The guideline now currently is 35,
yeah,
with a lower risk of heart attacks. I will come to that. 35 to 65.
Yeah.
But then the more data have been now accrued, and now it is extended beyond 65 years. In fact, Donald Trump, he is 70 plus.
Yes.
He underwent last week.
Oh, that's
he has
amazing.
some findings which I need not reveal here. So, but one exception generally is those who have already had heart attacks, whether they should undergo or not is a question, because you already have a heart problem.
Yes.
And you need to go through all the preventive steps.
Yeah.
So they are not in this list. And those who have what's called as a typical pain. Then when you say typical pain, somebody has pain on walking, which has been there for some time, or recent onset, then we don't wait for this calcium score. We straight away take them to the cath lab and do an angiogram, because
they're past that stage of screening.
Yes, he is already advanced.
Yes.
So the level will require interventions like angioplasty.
Yeah, that makes sense.
So otherwise, patients or people, I don't call them patients because they are now otherwise normal individuals.
Yes, yes.
So we start at 35, men, women at 45, till 70.
Okay.
And I have some data to say that it is not simply a matter of age which results in this. I've had people, subjects, who's 80 years old without a spot of calcium on their coronaries.
That's amazing.
And that's more so with women. I have a lot of men and women who at 80 didn't have. You might ask me why you did that at 80.
Yeah.
We also do other scans, chest, and then incidentally we see this, we also see the heart while you conduct tests for the rest of the organs like lungs in the chest scan, CT scan. And
it's part of
we
your
also
regular
see
screen.
that.
Yes.
We also see this coronaries at the same time. And not specifically at 80 we don't do calcium scoring.
Yes.
So that's our findings even at that age. You can preserve the coronaries even after the ripe age of 80.
Yes, so that's amazing.